So good afternoon, and thank you first of all for inviting me. It's a real pleasure to be here with you today. So my name is Steph. I am the Chief Executive of the Queen's Institute of Community Nursing, and I'll say a little bit more about that shortly. I'm also a district nurse by background, so that's been my role for the last 25 years, and I'm an advanced practitioner with prescribing rights. So today I want to talk to you about community nursing, advanced practice and primary care in the UK, and in particular how nurses are educated, supported and enabled to practice autonomously in community settings. So over the next few minutes, I will describe the role of the Institute, explain why community nursing is so important within the UK health and care system, outline the education and training pathways for specialist community nurses, and consider how expanded nursing roles have benefited patients, families, nurses and wider services. I will also touch on collaboration with physicians and multidisciplinary teams, digitalisation and some of the challenges that remain in the UK. So to begin, I'd just like to say a little bit about the Queen's Institute of Community Nursing. We're really known as the QICN, it's much easier. The QICN is the oldest nursing charity in the world. We are in the Guinness World Book of Records for that. And we were established in 1887. And we were established to train district nurses in the UK. So that's how far back community nursing goes in the United Kingdom. That historical purpose is still really relevant today. We, as an institute, continue to focus on the quality, development and recognition of nursing care delivered outside hospital settings. Today, the QICN supports nurses working across community and primary care, which includes district nurses, general practice nurses, community children's nurses, nurses working in palliative and end-of-life care, nurses who work in health and justice settings, and many others, including, I was just talking to Gerli at lunchtime, including nurses that we train specifically to look after our homeless population in the UK. Not something we're proud of, but something that is there. Our work also includes professional standards, education, leadership development, policy influence. We've heard how important it is to be at the table this morning, and my predecessor in this role used to say, we can either be at the table or we will be on the menu. I don't want to be on the menu, thank you. We also provide practical support for nurses working close to people's homes and communities. So why does community nursing matter in the UK? The graphic up here is our 10-year health plan, developed by the current government coming up to a year ago now, called Fit for the Future, and it is a plan for how we will deliver more care closer to home. So community nursing matters because that centre of gravity in healthcare has been moving away from hospitals and towards people's homes, general practice, care homes, hospices, schools, prisons and other community settings. This reflects the needs of our population. People are living longer, often with multiple long-term conditions, frailty, disability, social complexity, mental health care needs, or a need for palliative and end-of-life care. In that context, community nurses are central to prevention, early intervention, long-term condition management, wound care, medicine support, safeguarding, rehabilitation, palliative care, and reducing avoidable hospital admissions. The work is highly skilled because it often takes place in environments that are less controlled than hospital care. It's usually behind closed doors in somebody else's home. Nurses may be working alone, making decisions with limited immediate support, whilst also taking account of family circumstances, housing, social care, and the person's own goals and preferences. In the UK, registered nurses, community nursing expertise is developed after registration. So we first of all train as nurses, and then if you want to go on and specialise in something in community, there's an additional training pathway for that. So further post-registration education to prepare for specialist roles in community nursing. One of the most important routes is the specialist practice qualification. It prepares nurses to practice autonomously in defined fields of community nursing. It's generally either a year or a 2-year pathway, dependent on whether it's full-time or part-time, and in the main it is delivered at level 7, so at a master's level now, and it includes independent prescribing within that. So I said some of the specialist fields earlier, but the other ones, there are 9 pathways. We train nurses in adult social care nursing, so nurses working in care homes or in adult social care are trained to the same level as a district nurse or a general practice nurse and able to prescribe. These are not simply extensions of hospital nursing roles. They require a particular body of knowledge and skill related to assessment, risk management, independent decision-making, leadership, public health, care coordination, and working in partnership with individuals, families and communities. The Nursing and Midwifery Council, who are our regulator of nursing practice in the UK, approved updated standards for community nursing specialist practice qualifications in 2022. These standards are important because they describe the knowledge, skills and attributes expected of nurses working at a specialist level. They also help employers, universities and nurses themselves to understand what high-quality specialist community practice should look like. So expansion of nurses' responsibilities in primary and community care. Over time, nursing roles in the UK have expanded considerably. This has happened in response to population need, workforce pressures and a policy direction that aims to provide more care closer to home. Community nurses now routinely manage complex caseloads, lead teams, coordinate care across different organisations and make independent clinical decisions. One of the things in the 10-year health plan is a talk about integrated neighbourhood working, and I know we've heard quite a lot about integrated and collaborative working this morning, but that integration is critical and nurses are leading that in the UK. Many specialist community nurses are also, as I've said, independent prescribers. They prescribe within their scope of practice, but they can prescribe literally anything, including controlled drugs. But you have to know as a prescriber that it's within your scope of practice. So I can clearly stand here and say that I've never prescribed, for example, something, I don't know, some specialist medication that might be way outside of the scope of my practice. But I have prescribed lots of controlled drugs and lots of other things that have been relevant and appropriate for my patients and within my scope of practice. It's really important that our nurses can prescribe in the community because it can reduce delay, it improves continuity, and it allows care to be delivered in a more responsive way. For example, a nurse assessing a patient at home may be able to review the person's condition, identify what is needed, prescribe appropriately, and put a care plan in place without ever referring to another clinician. So what changed and what problems were we trying to address in the UK? So historically, care for people with complex needs could be fragmented. A patient might need several different appointments, referrals or professional contacts, which meant that their care was fragmented and wasn't joined up. There could be duplication, delays and uncertainty about who was coordinating a patient's care. The development of autonomous specialist community nursing roles has helped services respond more quickly and holistically. Nurses are better able to assess needs, plan care, prescribe where appropriate, escalate concerns, and coordinate support from the wider multidisciplinary team. This does not remove the need for medical colleagues or other professionals. Rather, it makes better use of each other's professional skills and helps ensure that the patient does not have to navigate a fragmented system alone. There are benefits for nurses and patients in this system and patient care. So the benefits of these nursing roles can be seen at several levels. For patients, the benefits include better continuity, earlier intervention, care closer to home, improved access and more personalised support. When a nurse knows the person, their family, their home circumstances and their wider care network, care can be more tailored and more realistic to their needs. For families and carers, community nurses often provide that practical advice, reassurance and coordination of care. They may be the professional who helps families understand what is happening, what to expect and who to contact if the situation deteriorates. For nurses, specialist education and autonomous roles strengthen professional identity. They provide clear career pathways, greater autonomy, leadership opportunities, and recognition of the complexity of work that has sometimes, I would say always, been less visible than hospital-based care. For the health and care system, these roles support hospital avoidance, provide safer discharge, support long-term condition management and integrated community-based care. They help shift the focus from reactive care to earlier intervention and prevention, which is essential if services are to meet the needs of an ageing population with increasing complexity. But we do, of course, have to collaborate. We can never work in isolation. It's fundamental to community nursing. Community nurses work closely with general practitioners, hospital specialists, pharmacists, allied health professionals, social care teams, voluntary organisations, carers and many others. In community settings, no single professional group meet all the needs of people living with complex health and social care issues. In practice, collaboration may happen through multidisciplinary team meetings, shared care plans, referral pathways, integrated neighbourhood teams, and informal professional relationships. It's important to say that the nurse's role is never a substitute for medical practice. We've heard that already. It is a complementary autonomous role, focused on holistic assessment, prevention, continuity, care coordination, and ongoing support. Good collaboration depends on trust, shared information, clear escalation routes, and respect for each professional contribution. When those conditions are in place, patients experience care that feels more joined up and less burdensome. A little bit about digitalisation in the UK, particularly in community and primary care. We do have problems, just like everywhere else in the world. It's a really important part of this picture, though. In the UK, digital healthcare is advanced in some areas, but still really variable across the services that we run and organisations. Primary care has used digital records and electronic prescribing systems for many years now. And patients increasingly access services online for appointments, repeat prescriptions, and parts of their health record. Tools such as the NHS app, remote consultations, electronic patient records, and data sharing are increasingly important. For community nurses, digital tools can support mobile working, safer documentation, communication across teams, and more proactive care planning. The ability to access and update records while working in the community can make a significant difference to safety and continuity. However, there are challenges. Systems do not always speak to one another. We were speaking last night about interoperability and how it's not very interoperable. Some patients are digitally excluded. That is a real issue for us in the UK, and I'm sure it is across the world. Staff need time, confidence and support to use digital tools as well. We've already heard today that the nursing population is an ageing population in itself. And certainly as somebody who was a child of the 1960s, some of this digital technology has been difficult to come to grips with, so we must take that into account as well. Connectivity can be difficult. So we do have quite remote parts of the UK where connectivity is not always as you would expect it to be, and that is a real challenge if you're out and about in the community looking after people. So digitalisation should be seen not only as a technical project, but as a workforce inclusion and service redesign issue. So what are our remaining challenges and what are the future priorities? So despite the progress made, significant challenges remain. Workforce shortages and recruitment pressures are major issues across community services. Community nursing can be highly rewarding, but it is also demanding. Nurses are working with complexity, uncertainty, and high levels of responsibility, often in settings where their work is less visible to the public and to policymakers. We need greater visibility and recognition of community nursing as a specialist and advanced area of practice. We also need education pathways that are funded, accessible and consistently implemented. Services need better digital infrastructure, shared records and more time released from administration into direct care. Future development should focus on prevention, health inequalities, integrated neighbourhood care, leadership and support for nurses practising autonomously in complex settings. So my closing message: the future of healthcare depends on strong community and primary care services. Nurses working in these settings need high quality education, clear standards, support for autonomous decision making and effective collaboration with other professionals. If we invest in community nursing, we invest in care that is closer to home, more personalised, more preventative and better aligned with the needs of people and communities. The UK experience shows the importance of national standards, specialist education pathways, professional leadership and collaboration across health and care systems. If we invest in community nursing, we invest in care that's closer to home. It's more personalised, it's preventative and better aligned with the needs of our patients and communities. Thank you.